tomorrow, December 31st, publicly funded PCR testing will only be available for those vulnerable individuals, including those with significant medical issues who are symptomatic or at risk of severe disease from COVID-19, including for the purposes of confirming a COVID diagnosis prior to beginning treatments. In addition, most individuals with a positive result from a rapid antigen test will no longer be required or encouraged to get a confirmatory PCR or rapid molecular test. Ontario also currently has a limited supply of rapid antigen tests, which is true around the globe, and that these are being preserved and prioritized for healthcare and high-risk settings to keep these settings safe. This means that if you have symptoms of COVID-19 and are not eligible for a PCR test and do not have access to a rapid antigen test, you should assume that you have COVID-19 and isolate according to our revised guidelines. Ontario is also changing the required isolation period based on growing evidence that generally healthy people with COVID-19 are most infectious for the 2 days before their symptoms develop and for 3 days after their symptoms. Individuals who are vaccinated, as well as children under 12, will be required to isolate for 5 days following the onset of symptoms. This also applies to their immediate household contacts. The isolation can end after 5 days if symptoms are resolved or improving for at least 24 hours and all public health and safety measures such as masking and physical distancing are followed. Effective immediately, residents of long-term care homes, retirement homes, elder care lodges, and older adults living in other congregate settings will be eligible for a 4th dose of an mRNA vaccine if at least 3 months have passed since their 3rd dose.